I should be looking at the wrong one.
And we're on. Hi, everyone. We're back at the Arthritis Broadcast Network #CArthritis event at the 2019 Canadian Rheumatology Association and Arthritis Health Professionals Association annual scientific meeting. I'm so excited to say these first two things. One, we have the program chair with us, so the guy who gets to take all the credit and all the blame, all the headaches, Dr. Tom Appleton, who's a very exciting rheumatologist, researcher, and also crafter, overseer of the development of this year's annual scientific program. So super happy to start with you as our very first guest, very appropriate. It's our 5th year here. So it is really important for me to thank you as the program chair, as well as the Canadian Rheumatology Association and Arthritis Health Professionals Association for really embracing this event for one. It was super odd for everyone the first year. We've grown, our studio has gotten hopefully more professional, and you guys are all so willing to come in and give of your time while you're doing the business of science translation, basically, through the membership. So thanks so much, Tom, for coming.
Thank you for having me, and it's a pleasure to be back again this year, and it's amazing to see the growth. I mean, you're thanking us for having you guys here. I mean, this is a tremendous opportunity, I think, to outreach to the community and the people that really are the reason behind all the things that we do here. So I think this is tremendous.
Oh, well, that's wonderful. That's exactly what we hope you say. So I want to start at the obvious place, and that is your role as program chair for this year's meeting. And I personally really love the theme, Building Bridges, because I think there's so many layers and ways to build bridges. And so I'm curious to know where that came from and how it's being manifested in the program itself.
Yeah, that's a great question. Yeah. We actually spend a long time trying to think about the right theme, and sometimes I'm not sure if it really does reverberate through the whole program. But as you say, something like building bridges, I think anybody can really kind of get their head around. It's a great metaphor for a lot of the things that we try to do, whether we're building bridges with public services and trying to get access to additional services for patients, or we're trying to build bridges with other colleagues and to improve our knowledge, whether we're building bridges through research or building bridges with different communities. I think what really brought building bridges together for us this year, what made it resonate, was some of the progress that's been made really more in the public sector, looking at relationships both historically that have been a bit maligned, as well as relationships that have been trying to be built and restored.
Right.
We think about Indigenous communities, right? We certainly think about other sexual orientations, those sorts of things that are really important, I think. And we'll see through the program this year that gender fluidity is an important topic. We think about the Indigenous Health Competency Initiative that has been chaired by Cheryl Barnaby and Lindsay Croce.
Which is tremendous work.
Tremendous work, seeing that coming together. So, I think building bridges certainly makes a lot of sense.
Yeah.
And of course, there's the obvious, they're actually building a bridge outside right now in Montreal. So, that was an easy one.
That wasn't lost on the program committee, was it? Oh, that's amazing. I'm really happy to hear you touch on the gender fluidity, the equity in I hope practice, and just the way we treat each other as professionals. I'm involved on a CHR committee, and we're constantly looking at ethics and the balance of funding distribution and the freedom and the right for people to go and actually feel they're being fairly judged when they put forward their scientific proposals. It is a great metaphor. And I think we live in an age, not just professionally, but in our world, sadly, where bridges are being torn down. So I personally just totally dig the metaphor. And I think our viewers will and do as well. I want to ask you, Tom, about the program itself. And if you reflect on the process that sort of was finalized once the program, they press send and that's what you're going to do. For you, so not as program chair, but more you as a clinician, as a clinical researcher, someone who's treating inflammatory arthritis patients, such as rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, but also has a very large body of research in osteoarthritis. When you look at the program, for you, what excites you? Like, what do you think that's going to be talked about at this meeting in particular that might have some direct application to patients?
Yeah.
Or at least not long after. So we know the research process is a very long one. So what's about ready to be delivered to the corner, right?
Yeah, absolutely.
Yeah.
I think there are many things that we could touch on there.
Yeah.
And every year there's such richness to the content that gets woven in.
Mm-hmm.
It's hard to touch on it all. I think, some of the things that are really starting to come to fruition will be touched on in our national update. So registry work and collaborative work. So talking about building bridges between, the CATCH cohort and AAC and CIHR and these sorts of initiatives that are really looking at models of care.
Yeah.
So how we find the most efficient and effective ways of delivering care to patients, not just in urban centers, but in all areas. And there's going to be different needs from center to center. I think, some of those things that are being studied right now in the real world context that we'll probably have results on in the next 6 to 12 months.
Great.
Will really form the basis of what we do in lobbying to provincial governments and that sort of thing to get models of care funded. I think that's really exciting to see that really coming together.
Yeah, I agree.
We need tangible, deliverable things from that, and I think that's one of the things I'm excited to hear about.
I mean, convincing government, I guess, at the end of the day, that's where healthcare is delivered, paid for. One of the things we've learned at Arthritis Consumer Experts is when you go out and you do that advocacy work, governments always tell you they're cash strapped.
Right.
So I think in the work that I've been involved with in the country around models of care, super important to know what provinces or jurisdictions within a province are doing well already, and how you lift up through your research the things you know to be a good model of care, how you help the province lift up the areas where they're not quite where you would like them to be, and certainly not where we might like them to be as patients. So do you have thinking around that? I mean, I don't want to sort of spill the beans early, but have you considered how you're going to look at these different areas of our country and the diversity, the incidence and prevalence perhaps of some types of disease versus another? Because we know in our Indigenous populations, inflammatory arthritis happens at a rate higher than it does in
2 to 3 times,
and it's worse. They get worse disease. So, when you're thinking about models of care, how do you address those disparities within these disease populations?
Yeah. We
I know that's not an easy question.
That's not an easy question.
Yeah,
Cheryl,
I know. Sorry, but you're so smart. I thought you could just whip off an answer.
And I don't have. Obviously, we don't have the answer right now. But honestly, I think the path to an answer. We have great tools available. We know that treatments are available, and we generally have a pretty good sense of how to use them.
Yeah.
The questions that we really grapple with now, I think, are down to social engineering kind of solutions. We need to build these bridges with different communities. We need to build trust in each other. We need to establish what are common and shared values so that we can start understanding better what's important to this community or to that community, to one region of the country or another region of the country, because there is no single solution that's going to be developed and just rolled out to everyone.
So models of care, in other words, Tom, sorry to interrupt, have to be adaptable to what's currently existing, fill in the gaps, but also very thoughtfully considering what those needs are in these different types of people.
We have to be sensitive to the way people live their lives, right? You can't just say, well, this is the way care is delivered and you must come to it. We know that doesn't work. That's been proven time and again. And it takes longer and it's harder to do, but I think it's worthwhile to do those efforts. And so, I think that the CRA members are quite open-minded and want and see the need for that and have plans for delivering on that. And I think we'll get there as long as we are all willing and open to working together. Well,
I think key to that, having been around for a long, long time in this community, Tom, it takes leadership, and I think you're really stepping up and showing that. We refer to you in our office as next gen. You're obviously now gen because you're sitting here leading this scientific program, so congratulations on that. I know that you have invited Andre Picard to the meeting, and he is a keynote speaker here. he's also running a workshop, and he's attending the meeting, which I think for arthritis, most of you probably know, when you crack open the Globe and Mail, you don't often read about arthritis. So I was really thrilled to see that you're making that happen. Do you have any insights as to what he will share with us at the keynote?
Yeah, well, I'm really excited to see his keynote. And I'm actually excited to see the workshop. The workshop is going to be focused on how to communicate with media. And, you know, I'm sure your listeners will be very well aware of how maligned the media has become. And, you know, sometimes for good reasons, but mostly the media is there to be the, you know, the public check and to keep people honest. And I think, you know, those institutions need to be upheld. And I think, you know, what Andre will be able to teach us as advocates in the arthritis community will be really valuable. So I'm looking forward to that. The keynote, you know, he's developed a reputation for having a really strong command of how healthcare is delivered in this country, its history, the evolution of it, and really what we've asked him to speak about is, where is this going? Where is our healthcare system going? Costs are going up. You know, we're seeing similar problems in the United States where the FDA is calling manufacturers to sort of be accountable for drug pricing.
We just had Senate hearings a couple of days ago.
Exactly. Right. So very current. And you know, we're certainly watching those things closely here. So, you know, we're excited to hear what Andre's perspective is on the healthcare system in general. As a share of the number of healthcare providers in the system, rheumatology is a very small proportion of that.
Which seems ironic because we're the largest population. I mean, there's 6 million Canadians, give or take.
That's right. Yes.
Pretty sizable piece.
That's right. Actually, and projected to grow sort of ever more. And so we're sort of you know, concerned about that, and we want to make sure that we have our voices heard, meaning voices on behalf of our patients and our allied health professionals who work with us and that sort of thing. So we're really excited to hear what he thinks, and hopefully there will be something in there for us that we can capitalize on. Some
pearls you kind of take away. Exactly. Well, I'm excited to see that. I want to ask you, Tom, about your own. You just gave a talk at the pre-course, which is the Arthritis Health Professionals Association meeting that occurs the day before the actual formal scientific program of the CRA starts. Right. And you were asked to talk about osteoarthritis. So the most common type of arthritis.
By far.
In the knees and what, base of thumbs?
And hip and hands. I mean, generalized is probably the most common form.
Yeah, exactly. So there's lots of people here with us on Facebook Live and Twitter Live who have osteoarthritis. So we want to know what you talked about, because that's the whole idea of the Arthritis Broadcast Network, is to fast track that knowledge out to the street. So tell us what you told them. And maybe I'll put you on the spot and say, what are the 3 tips you give osteoarthritis patients? Maybe and I'll give you a scenario. They've already got it. They've been diagnosed. They're in a lot of pain. They don't want to take medication. But they're desperate for your guidance, someone's guidance in the healthcare system to help them get out of pain, which is a prevailing symptom, not just in that type of arthritis, but many others. So I'm sorry, that was a bit of a run-on question.
That's okay.
So what you talk about, and what would you say to those patients?
Well, as you know, of course, the AHPA group is very progressive and very focused on, you know, the holistic patient experience and the role of not just medicine, but, you know, biomechanical interventions and you know, cognitive interventions and those sort of things. So it was a very enjoyable group to speak to about something that's as multidisciplinary as osteoarthritis. And, you know, so we talked about the fact that there's reason for hope, that there's a lot of exciting things that are coming. You know, just offline we were talking about some new anti-pain medicines that are in development that are very unique for the field.
And aren't opioids.
And are non-opioids, right? So not you know, carrying that same risk. And so we're excited to see where that goes. But there's also a huge amount of research that's coming to the fore now that's really shed light on new mechanisms, including in inflammation, that are key to osteoarthritis.
Yeah, we have about 50,000 members across the country, and you'd be surprised how many people go, oh yeah, but I have osteoarthritis, but my joints are really swollen.
Yeah, right.
And I started hearing from it, because they are. And so there's, similarly to inflammatory forms of arthritis like OA, there is a disease process going on there.
Yes.
So there's now you're really trying to focus on that.
Right.
Yeah.
I think an important distinction to make is that osteoarthritis has always been called a non-inflammatory disease.
Right.
But really what we mean by that is we're saying that it's not an autoimmune disease.
Right.
Right.
So we should tease that. We should stop that language.
Absolutely, we should. You know, and I think if patients very quickly grasp that concept, I talk about it with patients all the time in clinic. You know, this is not autoimmune, but there's inflammation, and treating the inflammation is an important part of that. That's kind of been under addressed.
Yeah.
So I think that's part of the reason that there's excitement.
Yeah.
There have been quite a few positive trials lately that suggest there may be some future benefits coming.
That's probably the number one question you get from your patients.
It is.
Isn't there something I can take
Yes.
to make this go away? And sadly, the answer for so long has been no.
Right.
So give us the 3 quick pearls.
Yeah.
What are you going to tell people who present the way I just described them?
Right. So number 1, stay active. Stay active. It's the Goldilocks theory, right?
Yeah.
So if you don't do anything, then you're going to lose your function and symptoms will get worse.
Yeah.
But if you overdo it, then you'll probably exacerbate things, at least in the short run as well.
Right.
So you've got to stay active and pace yourself.
Yeah.
So find that activity that you really like, whether it be swimming or cycling or walking or even just something, slow and gentle at home, yoga, those sorts of things that you can do that keep you active. So that I think that is probably the most important.
And you can be guided. There's so many videos on YouTube now. Put on YouTube and do it with a buddy, a virtual buddy, if you will. For people who are in real pain for a long time, and you say to them, okay, go be active, you know what the first response is. You're kidding.
Pain, right?
You're kidding me. Yeah. Mm-hmm. So what do you say to that person?
Yeah. I think at that point you want to find someone who can really assess your condition, right? And one of the things that I was talking about with the AHPA group today was that this is a multi-dimensional disease.
Right.
And if you don't address all of the dimensions, you're probably not going to get anywhere just by kind of picking one thing at a time.
Yeah.
And so being active is only part of it, but you may need to be enabled to how to do that.
Yeah.
And so you got to find out what are the things that are driving your condition. And so you need an arthritis professional to help you with that. And that may not mean that you have to stay following with that arthritis professional, month in and month out forever.
Yeah.
But to get some ideas of how to start working on all of those things. And really, I think what we talked about at the end of the day is integrating the biomechanical treatments with medical treatments, all at the same time, tailored to, so personalizing that medicine.
And make, not just tailoring it, but it's the whole person. That's where we started. It's the whole person.
That's right.
And as patients, we hear patient-centered care a lot, but we don't think we get it.
Right.
Because the whole person of us is not being considered, or we're not engaged in a discussion about our whole person. So I'm really loving what I'm hearing. I'm sure our viewers are as well.
Great.
So thank you so much. Anita, do we have any questions?
Is there anything patients can do to prevent themselves from getting osteoarthritis?
Oh, the inevitable question, Dr. Appleton.
Yeah, absolutely. So that's a great question, and I do get that one quite a bit.
Yeah.
I think the current status is that we don't think that there's a particular treatment or there's a particular lifestyle that will definitively prevent it, right? We know that risks include things like obesity, things like genetic risk, and certainly age play into that.
Injury.
Joint injuries.
Yeah.
So these are all risk factors that if you know you've got them, then you may want to be aware of that and try to, if you can, modify your lifestyle.
Get ahead of it.
Get ahead of it.
Yeah.
In front, right?
Yeah.
So, recognizing that's an important part of it.
Yeah.
But I think maybe even more important than prevention until we know how to really just, prevent, because we still don't even know how to prevent rheumatoid arthritis or other types of arthritis.
I know,
right?
sadly.
So
would you get on that, please?
It would be fantastic, right? Well, people like Hanny, I'll get Malawi are working on these things,
We're
right?
interviewing Hanny,
Perfect. That's good. You can look forward to that.
Yeah.
But until then, I think early recognition, right? And we've heard that before in other types of arthritis, that early recognition is probably important.
Well, and it's not dissimilar from what you hear in heart disease and diabetes.
Of course.
Or osteoporosis. You want to prevent osteoporosis from happening. So you need to know what the risk factors are.
Yes.
And then you need to incorporate other lifestyle changes or medication if needed.
Yes.
To do the things that will prevent.
Yeah.
And I mean, to me, when I learned what the incidence of OA is after an injury.
Yes.
And particularly a poorly rehabbed injury of the joint.
Right.
So if you're an athlete out there and you just think you're going to shrug it off, forget it. Go back and start and do the therapy you need, and that's really essential to preventing a lot of arthritis that we see, particularly
especially
in the knees
yeah.
and ankles, I suppose, and things
absolutely.
like that. Yeah.
Yeah.
Any other questions, Anita? Okay. So Tom, we know you're a busy guy. We know you have an entire program to run until what, Saturday afternoon?
Wow.
And
We've got a great team helping.
You got a great
that,
team.
So,
yeah, but I understand the burden that's placed on your shoulders, and they're broad, and we really appreciate you coming in. Our viewers really, you get lots of thumbs floating up the screen when you're on, so we really appreciate you coming. Yeah.
Well, I really enjoy being here, and thank you for doing this. I think this is a tremendous service to the community.
To arthritis consumer experts, to Arthritis Patient Advisory Board of Arthritis Research Canada, and to the Canadian Spondyloarthritis Association. We're the 3 patient organizations that live out there in the weeds. We're the grassrooters who help people day to day. We're your partner, really, in caring for the patients that walk through your office. So it's our pleasure. We couldn't be prouder of you and of the program and of the CRA for being really forward-thinking and for building bridges. So thanks for coming in.
It's a real pleasure. Thanks again,
Great.
Cheryl.
And I'll see you in the fall down mode at the end of the meeting. How's that?
Sounds good.
Okay.
Thank you.